Edmonton. Speaking to more than 100 young doctors gathered at the Poundmakers Lodge this week, Josie Auger suggested Indigenous culture could be more than a component of medical care. It can be a foundation. It's not just a placebo effect, it's real. We see miracles happen. Auger, an author and researcher who has focused on medical healing incorporating Indigenous spirituality, said to resident doctors in the University of Alberta's Department of Family Medicine. Dallas Arcand, a world champion hoop dancer, makes a presentation to resident doctors in the University of Alberta's Department of Family Medicine at the Poundmakers Lodge outside of Edmonton on Wednesday. Claire Theobald, Star Metro Edmonton, Elder Tony Arcand looks on as more than 100 resident doctors from the University of Alberta's Department of Family Medicine attend a workshop at the Poundmakers Lodge outside of Edmonton on Wednesday. Claire Theobald, Star Metro Edmonton, historical trauma, intergenerational trauma is real, Auger said Wednesday, citing studies that have shown links to diseases, physical symptoms of socio-economic issues and the colonialist history suffered by Indigenous people in Canada. The people you will be working with will have their own stories. Auger hoped that by encouraging young doctors to be more culturally aware, they could learn to incorporate elements of Indigenous culture into their practice, to provide holistic healing options that address a patient's physical and emotional health while breaking down institutional barriers. Like a sweetgrass braid, you braid everything together, said Darlene Marchuk, clinical director at Poundmakers Lodge. You take a little of the Western, you take a little of the Indigenous, and then you take where the person is at and you braid it all together. Article continued below. Marchuk says at Poundmakers Lodge, an Indigenous addictions treatment center, they incorporate the best of Western medicine, traditional psychology and Indigenous cultural practices as part of their holistic treatment plan, and she has seen and experienced firsthand the difference reconnecting with culture can make. Read more. Ontario government moving forward with Indigenous lesson plan but cancels meetings to improve it. Feds offer $30 million in prize money in bid to help Indigenous house increase. BC Reserve has been 17 years without safe drinking water. It's helping them draw from their own strengths that they don't recognize they have, Marchuk said. Marchuk, who grew up disconnected from her mother's culture and battled addiction but has been sober for 13 years, said she recalls suffering from terrible nightmares during her recovery, a common symptom among recovering addicts at the center. Article continued below. And she was given a dream catcher, which she admits she hung. Skeptically, she recalls waking from a nightmare and staring at the dream catcher. With it, she was able to calm her thoughts. Since that night I have not had another one of those nightmarish, using dreams, she said. Ceremonies such as powwows and sweat lodges, Marchuk sees those in recovery find emotional strength. They are standing tall, they are looking people in the eye, Marchuk said, noting that is part of empowering people to take an active role in caring for their health. After listening to Indigenous scholars, meeting with elders and taking part in a blanket ceremony, some of the residents left with a new perspective they were eager to incorporate into their practice. The experience today has been largely about getting a better understanding of the historical and cultural context of Indigenous people in Canada, particularly when it comes to patients that we treat that do come from First Nations, Métis or Inuit backgrounds, and better being able to ask appropriate questions when we are taking their history from them and better taking care of their needs when we see them in our clinics or hospitals, said Derek Chan, a second-year resident in the family medicine program at the University of Alberta. Olivia Lee, also a second-year resident in the family medicine program, said she left with a new understanding of the value of respecting patients as individuals, and how their personal context can help inform medical decisions. That can definitely be a big role in terms of treating them for their medical illnesses, not just a cookie-cutter approach, said Lee. Claire Theobald is an Edmonton-based reporter who covers crime in the courts. Follow her on Twitter, @ClaireTheobald.